Next. Dr. Mayuri, please.
Thank you.
Meanwhile, Dr. Satish is here. Please come to this.
Hello. Is the slide visible? Audio visual. Yes. May I start, sir? Yes. Good afternoon, everybody. This is one of the presentation that I wanted to show that in my experience, when I go to a multi-specialty hospital, I come across patients who present with neuro-ophthalmology and they have other problems like gynecology also. So this is one of the cases. The audiovisual team, can they just come and help me? It is not accepting this. Yes. So this is one of the cases that I've come across in my practice in last year. And she was a Gravida 2 Para 1 36-year-old female patient who had complained of double vision and blurring for 2 days. Her only history which was evident in the present pregnancy was a hypertensive history of 150 by 90 millimeter of mercury. Apart from this, she had no other practical symptoms. She came to the ophthalmic OPD with a presentation of, as said, 150-90 millimeter of mercury, and all the other parameters of the eye was normal, except that her movement of the left eye was limited to the left side. And there was no other offensive findings. There was no papilledema in the fundus examination, but there were slight grade 1 hypertensive changes. She didn't have any history of head injury, syncope, or seizures during the pregnancy. So during examination, we could see that the lateral rectus of the left side was absolutely paralyzed, and she was having blurring vision. So the neurologist in the hospital had already ordered for the MRIs. They had already been done. He could not find out any abnormality anatomically in the patient, and they had already also ordered for the contrast enhancement. That was also normal in this case. So what next? To discuss, absolute LR palsy in pregnancy is a rare condition in theory also so far. They could present with seizures, inflammation, intracranial pressure changes, and it could be a very false localizing sign to the gynecologist as well. But we have to take out the MRIs and pictures and the radiological evidences to rule out the space-occupying lesions like the meningioma or the chordoma that might be there. And we have to keep in mind that there was a sudden rise in BP of the patients. So the differential diagnosis of this patient would be definitely a pituitary adenoma because of hormonal changes, or maybe because of diabetes, hypertension, or any other tumors. While lateral rectus is commonly involved, any bleeding, infarction, or any vasoconstriction or vasospasm or thrombosis will actually very easily affect the lateral rectus because it has a longest course in the orbit and it takes a little bit long duration for recovery. So in this patient, the patient was furious, the attendants were furious, but all I had to tell them was to please wait and watch, because since all the parameters were normal, we could take a chance of taking a medical management. All the blood investigations were within time. So what did I did? Basically nothing. So you say it best when you say nothing at all sometimes, and we have to explain to the patient that it will take its own natural course. The Maxwell regimen was taken by the gynecologist. She was treated. The patient did not even agree to patching for diplopia because she used to feel nervous. So after a few months, thankfully, she came to normal after 8 months. And just to show that this was a rare case, because even in literature, if we find, there are very few cases that have been reported, only 9 cases so far from 1968 to 2015. And all these cases have resolved within a period of 1 to 3 months to 6 months. So sometimes it is actually that we don't need to intervene and we say nothing at all. Thank you.
Thank you. So it was just one case.
This one case that I had come across, ma'am, and literature, it has been reported 9 cases so far. So I reported this case. It is absolutely unusual, and it is basically the management part becomes difficult, ma'am, because the patient's attendants and all are very furious. So we waited, and the gynecologist managed the, basically in the line of PIH. So once the delivery was done, after the cesarean section, it took, I kept the patient for follow-up for 8 months, and now she is absolutely fine. Yes.
Okay, thank you.
Thank you, ma'am.